And we are live. It's Dr. J here in the house. We're going to go live here on Facebook in 1 second. All right. All right, and we are live. It's Dr. J here in the house. Welcome to this awesome live Q&A. What's going on? What's on your mind? Before we dive into questions, give me a thumbs up. Put your comments down below. Would love to know what is on your mind, what health topics you want to review, as well as what podcast and video topics you would like to come over your way. We'll be going and doing a live podcast today around 1 p.m. Central Standard Time. We'll be back in the saddle, and I'm going to go create some more videos after this. So if you guys have some content that's inspired and you want me to talk about it, feel free and let me know. All right, so first up, questions. Let's dive in. What can be done for obstructive sleep apnea? It depends on what the root cause is. If this obstructive sleep apnea just happened randomly as you got older, for whatever reason, typically there's going to be some level of inflammation dropping it or causing it, some level of weight gain, obesity, metabolic syndrome, high levels of insulin, higher blood pressure. There's typically some level of inflammation that's driving it and obstructing the breathing passageways. Now, again, if there's some kind of a trauma, you broke your nose, you had a concussion, car accident, we have to rule out anything that's physically obstructive. And you would just go see a really good ears, eyes, nose, or throat doc to rule that out. And again, there are different techniques like nasal-specific techniques that are kind of non-invasive, non-surgical that can be a really good thing to help you on the back end. But you really want to work on a lot of the inflammation. Inflammation-reducing things are going to be the big thing. So we're going to look at food. We're going to look at infections. We're going to look at blood sugar and insulin resistance. We're going to look at markers such as C-reactive protein, fibrinogen, homocysteine, sed rate, autoimmune issues, because all of those things are going to drive inflammation. The more we can get inflammation down, the better your passageways will be. We'll also look at using things like higher dose fish oil, systemic-based enzymes, curcumin, really good anti-inflammatory things to help work on supporting that out. All right, Akimo writes in, what kind of supplements, what kind of symptoms happen when one does antimicrobials without adrenal support? Well, the big thing is you're going to see typically more fatigue. You're going to see more fatigue occur. That's going to be a big one. You may see just more inflammation, more pain, more skin stuff. The more we have good anti-inflammatory systems on board, that helps with better IgA, better immune response. That's going to help with sleep. That's going to help just overall you kind of plow through that protocol and have it be on the right side of things there. Mo writes in, I take a lot of herbal supplements and they often give me a headache. Is there a reason and remedy for that? I tried drinking a lot of water, which helped a little bit. It really depends on what the herbs are. I mean, there are herbal killers that are designed to kill infectious debris in your body. There are things that are designed to help boost up your immune system. There are adaptogens that can help with stress and adrenal and cortisol. There are herbs to help with thyroid. There's herbs to help with digestion. So it really depends upon what the herbs are. Herbs aren't like a monolith, right? There are different things that do different things. So it really depends upon what the herbs. Agnes writes in, my 14-year-old daughter has stomach problems, diarrhea anytime we eat out. What can I do to help with her digestion? Why is this happening? It really depends upon what she's getting exposed to when she's eating out. Eating out, you're commonly going to be exposed to potentially MSG or potential gluten or dairy or other additives, artificial sweeteners. A lot of times there's junky fats like canola or soy, so it really depends upon what she's getting exposed to. If at home, under a controlled environment on a paleo template or autoimmune paleo template, she's doing good, then the key is just being able to go to a restaurant that you can control the fats, you can control the junk that's being put on the food. Ashley writes in, does Saccharomyces boulardii cause a Herxing reaction if you have candida? It depends, right? If you come in there and you're just throwing on a whole bunch of Saccharomyces boulardii and you haven't really worked on the diet yet, you haven't really done any killing, you haven't really worked on digestion, it's very possible you can get more of a die-off with Saccharomyces boulardii. So it depends. So that's why we do things within the 6 R's, right? First R, removing the bad food. Second R, replacing the enzymes and acids. Third R, repairing the gut lining and the hormones. Fourth R is going to be removing the infections. Fifth R, repopulating, reinoculating good bacteria. 6R, retesting. Matt White writes in, Dr. J, what are your thoughts on taking a cruise? I'll probably stick to buying bottled water rather than a ship water. I am thinking food may be harder as AIP and low FODMAP. Yeah, so like they're your typical cruises. I definitely recommend either get the food upgrade or do like a celebrity style cruise. They're called Celebrity. And you're going to get a higher quality food option. Cruises are notorious for just bad food. I've done I've done one cruise. I won't say the line of cruises, but with the food upgrade, it was a big difference. And I know celebrity cruises do offer a higher quality of food options, and they're more on point with it. So yeah, so look at a celebrity cruise, better food options. T-Bone writes in, I have eosinophilic esophagitis and Crohn's, been on immune suppression, azopathine for 2 years, 100 milligrams. Can I talk to my doc about tapering off? What can I expect? Any nutrition tips? So you got to work on getting all the inflammation under control. So eosinophilic esophagitis, that's going to happen when there's lots of inflammation in the upper stomach esophagus area. So what's the root cause? Is it an H. pylori issue? Is there poor digestion? Is there food allergens? Are there other infections? Is there SIBO? So a lot of these things is what you're talking about with the high amount of inflammation and eosinophils, which is a type of white blood cell. That's an effect. That's the effect. Now, there's a whole bunch of different causes that it could be. So we always start with digestion, food allergens, infections, and then of course all of the stress handling systems like the adrenals, etc. So we want to go down that list and start with all of those. Miss Lee writes in, are there any natural pain relievers for menstrual pain? Well, yeah, there are. So if you're having like cramping, you can do something called clary sage oil. You can rub it over the ovaries or over that area of cramping. There's an herb called cramp bark that can be used very well too. You can also do CBD oil. And then, of course, we would use different herbs to help fix whatever the hormonal imbalances are. Typically, there's lower levels of progesterone and or more estrogen dominance type of hormonal rhythm. And once you kind of can support that, you're going to see a lot less cramping. Excellent. Mo writes in, could taking all the herbal supplements at the same time put stress on my kidneys, which in turn invokes a headache? It really depends on what the herbs are, but if you're adding things in that are new and you're not sure, you should always add them in one at a time. That way, if there is an issue, you're going to know exactly what caused it. Grace writes in, hey Grace, hope you're doing well. Glad to see you. What are your thoughts on conventional testing for GBS during pregnancy? So I think GBS is group B strep. And what are your thoughts on group B strep in general? So typically just doing good quality probiotics like lactobacillus, acidophilus, bifidobacter type of species, that's going to reduce your chance of having any strep issues to begin with. So really work on having good healthy bacteria, good healthy probiotics in your system and a good diet, and that's going to significantly reduce your chance of getting group B strep. Matt White writes in, question regarding alcohol. Would there be an issue or benefits from consuming dry organic red wine maybe once a week? I mean, the benefits, you're going to get a little bit of antioxidants and resveratrol. The problem is you may get more potential gluten exposure or potential mycotoxin exposure in the wine, pesticide exposure. So make sure the quality's high. I typically do like a white wine because it's just a little bit less on the toxicity side, or a really good hard alcohol, whether it's a whiskey or a gin or a good clean vodka like Tito's, or I'll do like a nice dry Prosecco, lower amount of sugar. Dry Creek Wines has some decent stuff too. There could be some benefits. I don't have a problem, drink 1 or 2 days a week, maybe a glass or two, I think is totally fine. You can always add in some extra activated charcoal and glutathione and vitamin C if you want to be on the safe side. I don't have a problem with it as long as you are at a pretty good place with your health. If your health isn't in a good place and you're listening, stay off the alcohol till you get to a place of stability, and then you can add it back in socially. Ashley writes in, is it best to take a binder before or after using infrared sauna, and when is it best to take glutathione for detoxing mold? So I would typically say with the sauna, you'd probably want to take it before, but the difference with the sauna is the toxins are going out, they're not staying in. You may have some internal liberation of toxins, so I think on the safe side, taking it before is fine. You could also work on doing glutathione, I think before a sauna, I think is fine as well. And then just make sure after you do a sauna session that you use a really good quality sulfur soap, something that will cut any of the fat-soluble toxins off the skin, so then it will go down the drain and not stay on your skin. Because if you come out of a sauna and then you just sit and let everything kind of dry back on your skin, you will reabsorb the toxins. So let it come out, get a really good, like a 10% sulfur soap, keep it wherever, or get it, you can buy them in a container, bring them with you. So if you're at a gym or a local place, then you would shower off with the sulfur soap and then have it rinse off, and then you're good to go. Hope that helps. T-Bone writes in, food allergens, which I believe I have under control, feel in remission. Okay, got it. How to control blood sugar level with diet and exercise. So first thing is, think of your muscles as a sponge. So imagine you're cleaning up a big mess, right? Your kid spilled a whole bunch of juice or water, right? Maybe water in this example, and your sponge is saturated. So now you're just pushing around water, right? Well, you'd wring it out, and that wringing it out empties the water and allows you to reabsorb more stuff. Think of your muscles as like that. So when it comes to glucose, the more you exercise, you do some kind of a movement, you're squeezing out that muscle that squeezes out the glycogen and allows you now to reabsorb other glucose. So exercising does help with that. It soaks up the glucose so it's not hanging in your bloodstream. The longer it's hanging in your bloodstream, the more it's prone to, one, get converted to fat. All right? The more active you are, the more your body's going to be like, hey, it'll get burnt up anyway, right? So you have to dial in your carbohydrates according to your exercise. Resistance training or burst training helps because it wrings out that sponge and allows you to reabsorb it. And then number 3 is dial in your carbohydrates. So if you're at a good weight, you can always go up a little bit more on the carbohydrates, 75, 100, 150 on the net grams of carbohydrate. If you're not quite where you want to be, I recommend keeping your net carbs beneath 50 and do 80%. I would say 80% non-starchy vegetables with healthy proteins and fats at every meal is a good starting point. Excellent. Another cruise question, what would be some safeguarding supplements to bring charcoal? NAC, HCl, I'm thinking these, yes. So in general, I did an article or a podcast, I think 3 years ago, on what to do when you travel. Activated charcoal, probiotics. I typically would bring at least my GI Clear 4 in case you do get food poisoning. That's typically enough to knock out food poisoning, and or GI Clear 5 as well. And then, NAC or vitamin C or glutathione, any of those detoxifying things can help that way. If you drink too much, you're going to be able to detoxify really well. You can always bring a little bit of electrolyte support or just, order really good Pellegrino or Evian or really good clean water so you can up the minerals because you will lose a lot of minerals if you are drinking more. And then probiotics are good for food poisoning as well. And then melatonin can be great if you are changing significant time zones. Great questions, Matt. But take a look at that podcast on what to do when you travel. Agnes writes in, is diatomaceous earth always good for everyone? Is excessive hair shedding normal at first? Okay, so too many questions at once. We'll just hit one at a time. So is DE good for everyone? So DE is basically high-dose silica, and what it does is it can dehydrate infectious debris, whether it's ants or insects or worms in your body. So it can have some beneficial effects on killing things. It will dehydrate you, so get extra water in there as well. Okay, great. Any thoughts on heart palpitation in perimenopause, low estrogen, or hormone fluctuations? Yeah, it could be. Here's the deal. Like the more you have blood sugar issues or inflammation, the more you have adrenal dysfunction, the more chance of perimenopausal symptoms you have. So it just depends upon which systems are either in or out of balance. And so you could have adrenal issues, you could have thyroid issues, you could have blood sugar issues, you could have gut or inflammation issues. So it really depends upon which system is out of balance. And different systems can create an overlap of symptoms. So it's not like, hey, you have this symptom, it has to be this. There's a good chance it could be your adrenals or your thyroid, but we'd have to do more testing. But of course, foundationally, working on blood sugar is great. And then working on minerals, getting extra minerals in your body, magnesium, potassium, good sodium chloride is going to be a good first step. What heart max rate percent do you need to achieve HIIT? So high intensity interval training. I mean, typically with the high intensity interval training, you're going to be somewhere at 70 to 80% of your max heart rate. So typically the formula for max heart rate is 225 minus your age. So if you're 25 years old, that's a 200 max heart rate. So 80% is like 160, right? So somewhere like that. So most people, it'll be somewhere between 140 and 160. And the healthier you get, the faster that heart rate drops down. But to your question, I already utilize a lot of fat, but for supplementation to help balance blood sugar, chromium, cinnamon, fenugreek, how and when should you take these and how do they work? You only need blood sugar support if you are having insulin issues or you're already kind of have weight issues. So if you don't have weight issues, Matt, you can just stick to the core nutrient support like magnesium and chromium. That's enough starting out. You don't need anything else outside of that. And then if you're having problems, then you really got to look at, which I know you aren't based on your height and weight, then you would just look at exercise and dialing in your carbs. But if your blood sugar is looking good, especially based on a functional glucose tolerance, and you get a blood sugar meter, you test it fasting, then you do a 1, 2 hour, 3 hour. If it's staying beneath 140 to 120 in 1 hour, ideally 120, that's good. And if it's back below 100 within 2, that's great. If it's back below 100 in 3, that's still okay. So as long as your blood sugar is testing good in those areas, you don't need anything else above and beyond. Oliver writes in, have you heard of biopsychosocial model for pain? If so, do you believe it? I'm guessing that has to do something with the pain being more in your mind. I would need a little bit more of a definition of what that is. What are your thoughts on gallbladder polyps that are still less than 1 centimeter? Most of the time they are going to be benign, but you'd want to evaluate that. You want to look at getting inflammation under control, especially higher levels of insulin. That tends to be what the feeding ground is, of course, organic and such too. Dr. J, would you consider interviewing Dr. Jack Cruz again? I would be. I like Jack. The problem with Jack is he has a very difficult time answering questions, and he tends to make things that aren't that complicated very, very complicated, so then it's very hard to follow, and then it's hard to follow up. So Jack's a tough person to interview, but I'm open. If one has iron-based anemia, then do you not give serotonin and dopamine support and treat anemia first? It just depends upon what the presentation is, what the labs say. But of course, if we see any iron issues, we're on top of why that iron's there. Are you a vegan vegetarian? Do you have really poor digestion, right? Low stomach acid levels, maybe blood in your stool? Do you have hormonal imbalances that are driving lots of menstruation, at day 1 through 6 or 7? Are you bleeding too much hormonally? This is all for females on that side of the fence. We have to get to the root cause. So typically I always focus on iron first. You're welcome, Matt. Agnes writes in, is hair shedding normal while taking DE at first? If so, how long? It depends. It depends what else is going on. There could be other systems that are being exacerbated. So need to know a lot more about what's happening. Sue writes in, is it best to treat Clostridia species or a fungal infection first? Thanks. It depends if Clostridia and fungus is the only thing or not. If Clostridia is the only thing, typically we're treating bacteria before fungus. And then a lot of times we'll be treating H. pylori before that. So it really just depends upon what the presentation is. Excellent. Great questions. Command writes in, how do you have good quality of organic CBD, or will you recommend for sleep? Thank you. It depends. You want to get your CBD from a good quality source. I get mine from Bluebird Botanicals or other places that have really good high quality organic CBD oil. You want to make sure it's organic, pesticides are down. A lot of times they use some nasty solvents. So you want to just find a company that does it the right way. There are some good ones out there. So look at the company and the quality first. Hey, Seville. Hope you're doing good, man. All right, Barbara writes in, Dr. J, since starting the detox, I have experienced loss of loose stools that float. What's going on here? Stopped everything as I started a car trip and acquired food poisoning. Should I detox now? So it depends. If you're saying that you're starting to have more loose stools and they're floating because of the food poisoning, you'd probably want to get that food poisoning under control, okay? If your stools are looser in the meantime and there is food poisoning, adding some activated charcoal in to kind of bind up toxins can be helpful. We can also use some herbs, like in my GI Clear 4, which is like berberine, golden seal, like burdock root. Like some of those herbs can knock down that bacterial load. And I'm even okay adding in some probiotics like Bifidobacter, Lactobacillus species. So like my ProBioFlora would be enough to kind of, calm out, kind of push down any E. coli or Campylobacter or Shigella, whatever that bacteria is. We want to bind it up so you're not losing water and getting dehydrated through the stools, through the diarrhea. And then we can always up some extra minerals because you're probably losing minerals too. Suppressor wrote in, I went swimming. The fluid in my left ear will not come out, will not break free. I'm using colloidal silver as a preventative maintenance for infection. No spray. Any advice? So you have basically fluid in your ear. So yeah, you can do colloidal silver. You can do a colloidal silver 3% hydrogen peroxide mixture. That's totally fine. There could be some level of an infection in there, maybe a bacterial issue, but do the colloidal silver. I like the hydrogen peroxide because if there's any bad bacteria in there, you're going to know. You're going to hear it bubble up, and then you're going to hear it start to relax. So hydrogen peroxide is a really good thing. Try popping your ears. It should drain. So if it's not draining out, I'm thinking there's some level of infection. That's your good first step. And make sure you see a conventional doc if this issue is still a problem. K to Space writes in, if someone has low levels of bacteria or beneficial bacteria on a CSA, would you use probiotics or fermented food to treat? Definitely. But we would want to work on any bad stuff first, knock out the bad critters first. Sue, you're welcome. Agnes writes in, how long should we use a rebounder for to help out our lymphatic system? 5 minutes is fine. If you have a whole body vibration plate, 5 minutes is even better on that because it's just more intense. That 30 hertz frequency is really rejuvenating. I'm going to go do some whole body vibration after this. That's great. Agnes, you're welcome. Ashley, you're welcome as well. Yushi writes in, does taking mucus-breaking enzymes help with breaking biofilms? So like the kind of enzymes that are going to be helpful for biofilms, you're going to see like serrapeptidase from the silkworm is great. Lumbrokinase is great. There are some good enzyme products like Wobenzym that are good. Taking them away from food can be helpful. For biofilms, ginger is going to be amazing, especially for a lot of mucus issues. Ginger is really good, and silver is really good for biofilms. Vivek writes in, what can you do to alleviate fatigue and brain fog while in step 1 and step 2 for a person having a lot of infections? Well, it depends. What's exacerbating the brain fog? Is there a diet component to it? Is it being exacerbated by killing? So it really depends upon what's elevating that. So the first thing you can do is get the diet 100% dialed in, get your digestion dialed in, make sure you're regular with your bowel movements, 12 inches of stool every day. So start there and then see how we do after. Okay, great. Excellent. All right. You guys are great. Any other questions, let me know. If not, I'm going to go dive in, get some more content created for y'all. I'm going to be back at 1 o'clock for a live podcast on a topic that will to be determined. Evan's on a boat this morning, so we are going to be connecting this afternoon. So any other questions, y'all, let me know. All right, so comments below. Let me know what you think. I appreciate it, y'all. Oh, one more question came in. 2 more. What's the cause of histamine intolerance? So the more you're intolerant to histamine, it's typically because your inflammation bucket is elevated. I did a great podcast with Yasmina Yakelenstan. She actually passed away this time last year, which is sad, but she was a great person in the area of histamine. Take a look at that podcast. But just getting inflammation, and inflammation could be in many different forms, right? From food, from infections, from mold, from heavy metals, from poor digestion. So you have to get the inflammation down. Cat keeps getting sick. Soft cell tumor on ankle, feeding only raw and giving CBD. What else? Yeah, so get the food cleaned up. Animals notoriously are, fed the worst of the worst food. So get the food quality up. It sounds like you're doing that. You're doing CBD. That's awesome. So you're doing a really good job there. I mean, you could do systemic enzymes, but I'm not a specialist on the vet side. So I'd find a really good holistic vet, but I would look at systemic enzymes. And you could topically, you may want to topically hit that area with CBD as well. Rubbing it over the tumor, I think, could be very helpful. But I'd find a really good holistic vet to assist you in that. All right, excellent. Can one get rid of white stretch marks and post-acne scars completely? I mean, maybe not completely, but you'll be able to significantly fade them out. If it's on your skin, you'll be able to use lasers to stimulate collagen. And then potentially anything that's significant, you can always do some, there are some better fillers out there that can help fill in any holes that, from deeper pockmark scars. But vitamin C, topical vitamin C, topical vitamin A is going to be great. Good laser therapy. And there's some good stuff coming out with PRP. And then there's always some decent things you can do on the microderm side to help kind of smooth things out. But get your diet dialed in, get collagen in your diet up, get good essential fatty acids in your diet up. And then use some of those natural procedures like good CO2 laser. Find a good dermatologist that has experience. There's some micro needling that you can do as well as microderm. What are reasons for high serum B6? Only supplement with B6 for a couple of weeks. Serum doesn't matter. I mean, serum could be high. Think of essentially you're in a pool, right? You're in a floaty. Think of what's in your flotation as intercellular, what's in the water around you as serum, right? So serum just is telling you what's in the water. It's not telling you what's in your inner tube or what's in your cell. So make sure you're doing a high quality B6 supplement, and then you want to test B6, look at it intercellularly, whether it's with a SpectraCell or a Nutri-Eval, etc. Is it true that organic stevia leaf drops break up the protective film and barrier on candidiasis and fungus? I do know there is some antimicrobial benefits of stevia for sure. Just make sure it's organic and make sure there's not a whole bunch of corn maltodextrin in there too. Jan writes in treating H. pylori, is mastic gum resin more superior than its stem or branch counterpart? Typically the whole herb is good, but the resin is going to be good as well. I typically just try to use the whole herb in question. You missed my collagen question. Yeah, guys, if you have a question and I missed it, and then you just say that I missed it, I'm not going to ever go back up and look for it. So you have to punch it again. Other than using DE and colloidal silver topically, what else is best for teenager acne? Fix the diet. Most parents that have kids with acne, it's almost all dietary based, and they're typically not. Most kids see their other counterparts, their other classmates eating absolute crap. I mean, kids eat total junk today, and they don't see them having acne, but they may have other mood issues or focus issues. Not everyone's susceptible to acne, so they see other kids eating crap, and they're like, well, they don't have acne. Why can't I eat crap? Well, everyone's a little bit genetically different. So kind of starting on a paleo template, making most of their carbohydrates, vegetables, and or low sugar fruit, good fats, good proteins in there, and cut out grains and dairy 100%. Now, topically, I use the acne skincare line for Marie Veronique, which is very helpful, but it's not going to be the be-all or end-all, but it's a good first step. Okay, excellent. All right, guys, I'm going to jump off here. Phenomenal chatting with you. Give me a share, thumbs up, comments below. Really appreciate you guys participating, and I'll be back later on today. Take care, y'all. Bye now. Bye, Facebook.